video, are you making dangerous mistakes with vitamin supplementation? If you have kidney problems, supplementing the right vitamins is key to stabilize and improve your kidney function. But a recent study found out that all kidney disease patients hospitalized during the study had low levels of at least one vitamin. Having low levels of any vitamin is very dangerous. On the other hand, taking too much of the wrong vitamin can damage your kidneys even faster. But to look on the bright side, when you find ways to keep all the most important essential nutrients in balance, you will be able to help your kidneys do their job much better. This is exactly what we will achieve today. You see, there are vitamins that can help you manage blood sugar and diabetes. There are vitamins that will help you detox your kidneys. Certain vitamins, if taken properly, will even help you lower proteinuria levels. So let's see what vitamins you need and how to take them safely. A question before we begin. Is taking vitamins without getting informed really dangerous? We have recently examined the case study of a 54-year-old man that destroyed his kidneys by taking too much vitamin D. He had healthy kidney before receiving bad advice. In just a few months of taking 10,000 IU of vitamin D, he ended up with permanent kidney damage. Now guys, getting bad advice is even more dangerous for those with kidney problems. There are vitamins you are never supposed to supplement, such as vitamin A and K. So to avoid unnecessary risks, today I will show you the most updated info about what vitamins will really help you with diabetes and kidney disease. I also prepared some slides to show you so you can see the most common dosages on screen. So let's start immediately with the most important question. What vitamins are always bad for the kidneys? Soluble. There are 14 vitamins and they are divided in two groups. Fat-soluble vitamins, A, D, E, and K, and water-soluble vitamins, B group and C. This is an important difference. Someone with kidney disease is supposed to supplement all water-soluble vitamins and to be very careful with fat-soluble vitamins. What to avoid? Now, vitamin D is the exception, as we can see, because even if it's fat-soluble, you are still supposed to supplement it. So to answer the question, what vitamins are dangerous for you? We have three vitamins you will usually be told to avoid: A, E, and K. Now, supplementing vitamin A is especially dangerous, and it's also the reason why people with kidney problems are recommended to avoid regular multivitamins. Vitamin A can easily build up in the body and it can cause nausea, vomiting, headaches, and in more severe cases, it may cause serious liver and kidney damage. So the only occasion in which you are supposed to supplement it is when your doctor explicitly tells you to. Now remember that these risks are only linked to the use of supplements. Eating foods rich in these vitamins do not present any danger unless you are eating kilos of cod liver. Now vitamin K comes with some risks too, as it makes the blood more prone to clotting, and these may be dangerous for certain patients. Vitamin K and E are not as dangerous as vitamin A, and vitamin E in particular may even come with some benefits, especially for people with diabetes. In a recent study, this vitamin was used to achieve a significant reduction in blood sugar levels and in creatinine levels in diabetes patients. Now, in CKD patients, however, the guideline is to avoid supplementing this vitamin. Eating foods rich in vitamin E is alright, however, and select patients may really benefit from a supplement too. So if you want to know more about how to safely benefit from this vitamin, watch my video up here. Okay, we have seen what to avoid. Now question, what vitamins are crucial to supplement? Now guys, given the inherent dangers of taking multivitamins, some people may think that it will be better to avoid supplements altogether, and this may even work for the general population. People with diagnosed kidney disease absolutely need to keep their levels of these three vitamins high enough. Vitamins of the B group, vitamin C, and vitamin D. You see, these three vitamins are often too low in patients with CKD. So let's take a look at how to supplement them, starting with vitamins of the B group. Here. Question: why do you need to supplement B vitamins? Vitamin B6, vitamin B9 and vitamin B12 are key to fight anemia, but all these vitamins are crucial for your health. It's almost impossible to get enough of this in a renal diet, and they are all very important. Vitamin B12 is also crucial to fight fatigue. Some people consider it the energy vitamin. Vitamin B6 is frequently too low in people with kidney problems, and it's crucial for the nervous system and immune system. Vitamin B2 or riboflavin boosts the immune system and fights headaches. Vitamin B3 or niacin helps with cholesterol. B5 fights stress. B7 and B1 lower blood sugar in diabetes. And also consider that each one of these vitamins comes with a long list of nasty side effects when the levels are too low. Now, what you can see in my slide are the most commonly supplemented dosages for all vitamins of the B group. Recommendations for people with CKD are different from those for the general population, as we can see. You are supposed to supplement even 6 or 10 times more of certain B vitamins. And while there are multivitamins with these exact doses, you don't really need to be this accurate when it comes to B vitamins. If you take a little bit more, it's usually not a big problem. The exceptions are vitamin B3 and B6. High doses of supplemental B3 or niacin may lead to vomiting, high blood sugar levels, skin flushing, and even liver damage. And also high doses of B6 can cause nerve damage, light sensitivity, and painful skin lesions. So make sure your vitamin is close to what you see here in terms of B3 and B6 especially. Another side effect of B-complex supplements is that they can turn your urine bright yellow. Although discolored urine can be shocking, it's not dangerous. It's simply your body getting rid of excess vitamins. And there are various supplement brands selling vitamins of the B group in doses suitable for people with CKD, and I've linked a couple down in the description. Now, in alphabetical order, next vitamin you need is vitamin C. Vitamin C is crucial for good kidney health. This is an extremely powerful antioxidant, and antioxidants are key to protect the kidneys and slow down CKD. Vitamin C also fights inflammation. It can detox the body from excess uric acid, and it's even linked to lowered blood pressure and cholesterol levels. And vitamin C is also key when it comes to fighting anemia. Anemia is extremely common in CKD, and it's a known cause of kidney damage and even death. You really want to get enough vitamin C every day, both from foods and supplements. Talking about supplements, while vitamin C is water-soluble just like B vitamins, it comes with some dangers. Don't supplement too much of this vitamin unless instructed by your doctor. So how to correct supplement vitamin C? When it comes to vitamin C, many supplements contain extremely large amounts of the vitamins, which can cause serious problems. Main danger here is the formation of kidney stones. This is especially a concern for people with a water allowance. Vitamin C in high doses and low water intake is bad. Vitamin C in high doses and low water intake is a bad combination. Also be very careful, especially if you have a history of calcium oxalate kidney stones. Now, vitamin C is also crucial for good kidney health, and if you take it in a low dose, it is also 100% safe. So even if you don't have a deficiency, consider supplementing vitamin C. But be careful with supplement you buy. Many supplements on the market contain 500 milligrams or even 1000 milligrams per single pill, and that's too much. Actually, you will get most of the benefits this vitamin has to offer already with a dose as low as 100 milligrams per day. Most multivitamins marketed for kidney disease patients only have 60 milligrams of vitamin C, and that's already enough. Another recommendation when it comes to finding the right supplement for vitamin C: look for ascorbic acid, not for the more common sodium ascorbate. Sodium ascorbate contains sodium, aka salt, and you don't really want to supplement salt to your diet. Now guys, one more vitamin to see, maybe the most important. A word of advice before we get to that. Remember that the dosages and tips I give you here are not meant to replace what your doctor may prescribe you about vitamins or treatments. I'm telling you this because I always get comments of people asking me to double check if what their doctors prescribe them is correct. But you see, it should be the other way around. You should be asking your doctor if what I suggest you is right for you. The right dose for any vitamin depends on your blood analysis and on any symptom you may have. And I don't know that. I don't know your levels for any vitamin. Your doctor is the only one that can tell you what right dosage for you is. So my point is, I'm here to inform you. I can definitely point you in the right direction, showing you what vitamins are known to help and how to take them, but your doctor has the final say. You should be asking your doctor if what I say is good for you, not the other way around like I see happening all the times. So let's take a look at how to supplement the kidney vitamin. Vitamin D. This is maybe even more important than vitamin C and vitamins of the B group because it fights proteinuria, a marker of kidney health, just as important as creatinine. This vitamin here significantly reduced the severity of proteinuria among patients with CKD in studies. Also, kidney disease patients with the higher levels of this vitamin are considered less at risk of dying. But the most important thing about vitamin D is that it's almost always too low in those with kidney problems. A recent study found that all kidney disease patients hospitalized during the study had low levels of vitamin D, including those supplementing it. This happens because the kidney is the organ supposed to convert vitamin D2 and vitamin D3 both from the sun and from foods or supplements into the active form the body needs. The active form of vitamin D is called calcitriol. Notice that this is different from cholecalciferol or vitamin D3. So there are two things you need to do when it comes to vitamin D. First, supplement it. There is no harm in taking around 2000 IU of vitamin D3 every day as long as you take it with enough vitamin K2 and magnesium. Now, as we can see here, general recommendation is to take vitamin D3 2000 IU with vitamin K2 100 to 300 micrograms both in the morning and with some fats to improve absorption. You see, vitamin D is actually a pre-hormone and it helps the body raising calcium levels. Vitamin K2, on the other hand, tells the body where to put calcium. People taking vitamin D without vitamin K2 may risk unwanted calcification in tissue and veins, and that's no good. Now, the other thing you should know about vitamin D is that you also need to take magnesium when you supplement it. Magnesium levels are often too low in those with CKD, and if that happens, it will be much harder to raise serum vitamin D levels. This mineral is used by the body in the metabolism of vitamin D. Taking large doses of vitamin D without enough magnesium can induce severe depletion of magnesium, among other things. The solution: also supplement magnesium. Magnesium deficiency is very common among people with kidney problems, especially those taking diuretics and in diabetics, and it may cause poor sleep, inflammation, high uric acid levels, and high blood sugar levels. Some of the worst risk factors for CKD. This is a deficiency you absolutely want to avoid. Lower serum magnesium levels are also associated with an increased risk of both ending up on dialysis and death. Magnesium is usually taken in the evening because it will help you relax. And for those with kidney problems, magnesium oxide 3400 milligrams a day is recommended. Second thing to know when taking vitamin D. Get checked regularly for vitamin D3 levels even if you are supplementing it. As we have seen, the kidneys convert this vitamin into the active form. It may happen that someone supplementing it cannot raise their serum levels enough. So ask your doctor to be tested for vitamin D3 levels. What to do if you are already supplementing vitamin D3 but your serum levels keep being low? In some cases, getting higher doses may help, but if that doesn't work, you will need a special prescription from your doctor. Okay guys, this was pretty thorough and you probably have now a better understanding on how to benefit from vitamins without any risks. Remember that you can ask any questions about vitamins down in comment section. I usually try to answer as many as I can. You may have noticed that I haven't talked about what foods have this much needed vitamins in them. So if you want to know more about that, please watch my video up here. And this is all for today. Thank you for watching. God bless.